Good morning, students. Today I'm going to talk about what is ketosis or ketogenesis. We will see how ketosis is caused, what are the factors which cause ketosis. First of all, we'll see what are ketone bodies. Are they normally produced? If they are normally produced, what is the condition that leads to ketosis? And then how it is regulated, and what are the clinical symptoms of ketosis. So when we take carbohydrates as the basic energy source, like glucose is the energy source, right? That is absorbed, channeled to liver, and there it is stored in the form of glycogen. In healthy humans, the body is continuously making small amount of ketones to be used by the body for energy, like in times of fasting or even overnight while sleeping. The amount of ketone bodies may vary, but there is a normal production of this ketone bodies. Um, these normal pathway to create energy may involve stored carbohydrate or non-carbohydrate substances. So when energy is needed, if there is enough of carbohydrates present in the body, there is glyconeolysis, right? Glycogenolysis. That means you have the breakdown of glycogen which is stored in the liver and muscle, and you have energy production. Or there is another pathway called gluconeogenesis, that is glucose is produced from non-carbohydrate sources such as lactate. When you are exercising so much, gluconeogenesis can happen. So when you have, this is a condition when there is normal carbohydrate stored. But when you have reduced carbohydrate stores or significantly reduced because of some situation, and then you have more of fatty acids in the blood, then there is upregulation or production more of this, what is called as ketone bodies, or upregulation of ketogenic pathway. So what kind of conditions causes this is type 1 diabetes, alcoholism, and starvation. So this is in the, not only in this situation, normally is also ketone bodies produced as an alternative source. The brain utilizes this ketone bodies as not an alternative source, and the peripheral organs utilize the ketone bodies as the alternative sources. So coming to the types of ketone bodies, you basically have three types of ketone bodies which can be seen. Primary is the major component is the acetoacetate. The secondary are the hydroxybutyrate, beta hydroxybutyrate, and acetone. These are produced by breaking down of results of breaking down of fatty acids. These ketones are lipid soluble. Why they are called ketone? Because the carbonyl group is attached to two different ara groups on its sides. Because they are water soluble, they do not require lipoproteins for transport. And of these three, acetoacetate and beta hydroxybutyrate are acidic, having pKa value of 3.6 to 4.7, causing the acidosis. So how does ketogenesis happen? Ketogenesis occurs primarily in mitochondria of liver cell. Fatty acids are brought into mitochondria via carnitine palmitoyl transferase. It's also called as CPT1. We know we have done the beta oxidation. So in that, the fatty acids are carried into mitochondria via this carrier protein carnitine palmitoyl transferase, and then they are broken down into acetyl CoA via beta oxidation. Two acetyl CoA molecules are converted to acetoacetyl CoA by the enzyme acetoacetyl CoA synthase, and then this acetoacetyl CoA synthase is converted to HMG CoA, that is beta hydroxy beta methyl glutaryl CoA. Then further it is converted to uh, acetoacetate and acetyl CoA with the enzyme HMG CoA lyase. Acetoacetate can be converted to either acetone through non-enzymatic decarboxylation or to beta hydroxybutyrate via beta hydroxybutyrate dehydrogenase. Acetoacetate and beta hydroxybutyrate are the two ketone bodies used by the body for energy. So, ketone bodies are formed in liver, but they are utilized in extrahepatic tissue. Now, coming to this, liver is the one which produces ketone bodies. They are carried over in blood and they can be used in lungs or can be thrown out in urine, or they can go to extrahepatic tissue. They be utilized in citric acid pathway. Ketone bodies are formed in liver, but they are utilized by extrahepatic tissue. The heart muscle and the renal cortex prefer the ketone bodies to glucose as fuel. Tissues like skeletal muscle and brain, apart from that you have other tissues also like placenta, intestinal mucosal cell, adipocytes, they all use this ketone bodies. Almost all tissues and cell types can use ketone bodies as fuel with the exception of liver and RBC. Why? The liver, although it's a primary site that produces ketone bodies, that does not have the capacity to use ketone bodies because it lacks the necessary enzyme beta ketoacyl CoA transferase. That's an important, it can be asked as a 2 marks question. Why liver cannot use the ketone bodies? So once they are produced, they are transported to the blood, and wherever it is needed, it is absorbed. Once they reach, for example, take extrahepatic tissue, once they reach the extrahepatic tissue, beta hydroxybutyrate is converted to acetoacetate via the enzyme beta hydroxybutyrate dehydrogenase, and then acetoacetate is converted back to acetyl CoA via the enzyme beta ketoacyl CoA transferase. I'll repeat this again. Once the ketone bodies, that is acetoacetate or beta hydroxybutyrate, reaches the site, that is the extrahepatic tissue, beta hydroxybutyrate is converted to acetoacetate via the enzyme beta hydroxybutyrate dehydrogenase, and acetoacetate is converted back to acetyl CoA via enzyme beta ketoacyl CoA transferase. Acetyl CoA goes through the citric acid cycle, and after that is oxidative phosphorylation. So you know that the total of that TCA cycle and oxidative phosphorylation produces 22 molecules of ATP. Acetone as such is not converted to acetyl CoA, rather it is excreted through urine or exhaled through the lungs. When the rate of synthesis exceeds the ability of extrahepatic tissue to utilize them, there will be accumulation of ketone bodies in blood. This leads to ketonemia, excretion in urine, ketonuria, and small amounts of smell of acetone in breath. All these three together constitute a condition called as ketosis. Now, this ketogenesis can be regulated by the hormones. Hormones like, apart from glucagon, you have other hormones like cortisol, thyroid hormone, catecholamines. They upregulate ketogenesis by causing greater breakdown of fatty acids, thus increasing the amount of available fatty acids to be used for ketogenic pathway. Insulin is the main hormonal regulator of this process. Insulin regulates many key enzymes in ketogenic pathway, and a state of low insulin triggers the process. A low insulin can lead to decreased inhibition of hormone sensitive lipase. When there is decreased inhibition, there is increased uptake of free fatty acids into mitochondria. Due to decreased activation of acetyl CoA carboxylase, which decreases malonyl CoA, which disinhibits carnitine palmitoyl transferase 1, thereby increasing the process. That also leads to increased production of ketone bodies. Apart from that, it can also increase the activity of HMG CoA, that eventually leads to increase in activity, increase in ketone body in the blood. Ketone bodies produced during ketogenesis can be measured with urine analysis. You can have a range from 0 to 4. 4 is the highest. Acetone produced from ketogenesis can be directly measured in blood serum, and normal levels are 0.6 millimole per liter. So the causes again: diabetes mellitus, starvation, and then alcoholism. During pregnancy also ketosis can be caused, because there is starvation like condition which may lead to ketosis. The brain derives 70% of the energy from ketone bodies under conditions of fasting. Now coming to clinical features. So what happens when there is overproduction of ketone bodies via ketogenesis? It causes a problem because they are acidic in nature. It causes a condition called as diabetic ketoacidosis, where there is overproduction of this ketone bodies. It occurs where there is lack of resistance to insulins, that is in type 1 diabetes condition, and also people with advanced type 2 diabetes, where enough insulin continues to prevent ketogenesis. Due to lack of glucose brought in by insulin, cells start to produce glucose via gluconeogenesis. This process, along with existing glucose that cannot be brought in with insulin, greatly elevate blood glucose levels. The threshold for diabetic ketoacidosis is glucose level 250 or more than that. Once carbohydrate stores are depleted and gluconeogenesis cannot occur anymore, ketogenesis is substantially increased and there is large amount of ketone bodies produced. Due to acidic nature of beta hydroxybutyrate and acetoacetate, this causes an anion gap metabolic acidosis. So when you see these patients, they are basically looks like dehydrated because of hyperglycemia, and their osmol concentration of glucose is very high, which leads to reduced water absorption in kidney. Along with being dehydrated, patients will present some conditions like confusion, nausea, vomiting, abdominal pain. And because of acidosis, patients often breathe very deeply and rapidly to eliminate carbon dioxide and cause respiratory alkalosis. This process is known as Kusamal breathing. And over time, a patient can experience respiratory distress due to prolonged excretion of respiratory muscle. Due to prolonged exertion of respiratory muscles. Cerebral edema can also occur in severe cases, and the patient can go to coma. Because of the acetone produced by ketogenesis, patients can breathe that smell like fruity or nail polish removal kind of a smell. So if you want to treat this diabetic ketoacidosis, it involves giving glucose and insulin to not only lower blood glucose levels, but also to downregulate the ketogenic pathway and decrease the number of ketone bodies produced. So this ketoacidosis can also occur during starvation and prolonged alcoholism. So in this short video, I have covered what is ketone, what are ketone bodies, examples of ketone bodies, and then how ketone bodies are produced, how ketone bodies are regulated, when what conditions ketone bodies are produced more, and what is the normal range, and one clinical symptoms diabetes ketoacidosis, what are the symptoms, and then how can you regulate diabetic ketoacidosis. Thank you.